This medication is used to prevent or treat low blood calcium levels in people who don't get enough calcium from their diets. It can also be used to treat conditions caused by low calcium levels such as bone loss, weak bones, decreased activity of the parathyroid gland, and a certain muscle disease. It's also used to make sure certain patients are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, and people taking certain medications like phenytoin, phenobarbital, or prednisone. Calcium is essential for the normal functioning of nerves, cells, muscle, and bone. If there isn't enough calcium in the blood, the body will take calcium from the bones, weakening them. Vitamin D helps the body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium, and phosphorus is important for building and maintaining strong bones. The recommended daily dosage of calcium 600 Vit D3 is typically 1 tablet daily, or as directed by your doctor. It's best to take this medication with a meal to increase absorption. It's important to follow the dosage instructions provided by your doctor. When taking calcium 600 Vit D3, it's important to take it with food to help with absorption. If your daily dose is more than 600 mg, it's best to divide the dose and take it throughout the day. If you're using the liquid form, be sure to measure the dose carefully with a special device, and if it's in chewable form, be sure to chew thoroughly before swallowing. It's also important to take the medication at the same time each day for the best results. If your doctor has recommended a special diet, be sure to follow it closely. And finally, it's best to consult with your doctor or pharmacist to determine the best form of calcium supplement for your needs. If you experience a serious medical issue, seek medical help immediately. If you experience constipation or stomach upset while taking calcium 600 Vit D3, inform your doctor or pharmacist promptly. Your doctor has prescribed this medication because they believe that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as nausea/vomiting, loss of appetite, unusual weight loss, changes in mental/mood, signs of kidney problems, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. Although rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before taking calcium 600 Vit D3, it's important to talk to your doctor or pharmacist about any allergies you may have to it or other vitamin D products. This medication may also contain inactive ingredients which could cause allergic reactions, so it's important to discuss this with your pharmacist. When considering using this medication, it's important to talk to your doctor or pharmacist about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, little or no stomach acid, low levels of bile, or untreated phosphate imbalance. If you are considering using the chewable tablets, it's important to be cautious if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit/avoid sugar or aspartame. It's best to ask your doctor or pharmacist about using this product safely. If you are pregnant, it's important to talk to your doctor before using this medication. Doses of vitamin D greater than the recommended dietary allowance should only be used when clearly needed during pregnancy. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking calcium 600 Vit D3. It's best to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Certain medications like digoxin and phosphate binders may interact with calcium 600 Vit D3, so it's important to discuss this with your healthcare provider. Calcium can also affect the absorption of other drugs like tetracycline antibiotics, bisphosphonates, levothyroxine, and quinolone antibiotics. Additionally, certain medications can decrease the absorption of vitamin D. It's recommended to separate the doses of these medications from your doses of calcium/vitamin D as much as possible. Your doctor or pharmacist can help you find a dosing schedule that works with all your medications. Be sure to check the labels on all your prescription and non-prescription products, as they may contain calcium, phosphate, or vitamin D. It's important to talk to your pharmacist about using these products safely. If you're taking vitamin D, it's important not to use medications containing calcitriol at the same time. It's also important to be aware that calcium 600 Vit D3 may interfere with certain lab tests, potentially causing false results. Be sure to inform your lab personnel and doctors that you are using this product. If you or someone has taken too much calcium 600 Vit D3 and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, changes in mental state, headaches, drowsiness, weakness, and fatigue. Always be mindful of the proper dosage and seek medical help if you suspect an overdose. When taking calcium 600 Vit D3, it's important to have regular medical tests to monitor your calcium levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Foods rich in vitamin D include fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body can also produce vitamin D when exposed to sunlight. Foods rich in calcium include dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables like broccoli, spinach, and bok choy, and calcium-fortified foods like orange juice. To reduce the risk of bone disease, it's recommended to stay physically active, avoid smoking, and limit alcohol and caffeine intake. It's also important to take the recommended daily dosage of calcium 600 Vit D3 and consult your doctor about the best time to take it. If you happen to forget to take a dose of calcium 600 Vit D3, you can take it as soon as you remember. But if it's close to the time for your next dose, then it's best to just skip the missed dose. It's important not to take a double dose to make up for the missed one. Just take your next dose at the regular time. It's important to store calcium 600 Vit D3 at room temperature, away from light and moisture. Keep it out of the bathroom and in a place where children and pets can't reach it. When it expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.